Welcome to Better Sex, where you get the information and inspiration to create and enjoy your best possible sex life. Join your host, sex therapist Jessa Zimmerman, as she brings you expert guests, helpful tips, knowledge, and strategies to improve your intimate relationships. And now, your host, Jessa Zimmerman.
Hey, welcome back to another episode of the Better Sex Podcast. This is Jessa, and I am just delighted you're here. I'm in a good mood today. Get a couple of recordings, and I just had a fascinating conversation with Dr. Kanwal Bawa. She is a doctor in Boca Raton with a clinic where she has fallen into a practice around sexual health. It wasn't her original plan. She actually does all kinds of rejuvenation work around the body, but has really loved the work in vaginal rejuvenation. Now, penile rejuvenation too. She works in sexual health of both men and women, but we're talking specifically today about female orgasm, about vaginal health, and about how these two things come together and the kinds of medical options there are for rejuvenation in which she specializes and what kind of difference that can make. And I think this is a really interesting conversation. It's thought-provoking because she really talks about this as a preventative, not only a treatment for menopause or lichen sclerosis or cancer or even after childbirth, but that's something people could do more preventatively for upkeep, I guess I would say, before really there are problems that you're trying to solve. So anyway, I hope you find the conversation interesting and valuable. And before we start the show today, it is sponsored by Intimacy with Ease. It's a method to help otherwise happy couples achieve a sex life that is easy and fun for both of them, so that you can actually just enjoy your sex life with zero stress. For more information, if you want to watch a brief little training video that's available, all of that, go to intimacywithease.com. So, Dr. Bawa, thank you so much for joining me today.
Thank you for having me.
So I'm going to start right in with your nickname. So people call you Dr. Sex Fairy. How did that come about?
Well, that's funny. Yes, they do call me Dr. Sex Fairy because I make magic happen in people's sex lives. So I sprinkle some of my unique fairy dust and I make dreams come true. So that's why I'm Dr. Sex Fairy.
That sounds so simple. Just sprinkle the dust.
Simple, yes, indeed. Simple, but not quite.
Right. All right. So we're talking about female orgasm today. So I guess I would start by asking you how you would put into words the importance of this, the value of this for women.
It's really unfortunate that most men assume that they will orgasm and most women assume that it may not happen for them.
Mm-hmm.
And I find that very ironic because the female anatomy belies that notion. A clitoris has 8,000 nerve endings, 4,000 in a man. So when we have that many nerve endings, I would think that God or, whatever you'd like to call the higher power, nowadays, easy to be politically incorrect with everything one says. So in my world, God made that for a reason.
Yeah.
Why aren't we women using it more often? I think there are a few different reasons why women are assuming that they're not going to have an orgasm. I think things change over time. Firstly, I don't know that men or women really understand female anatomy.
Right.
It's easy to blame the men, but when you look at studies, a large proportion of women themselves cannot identify their own anatomy correctly. A lot of my patients have been very confused when I've looked at them and said, but you don't pee from where you have sex. And they're genuinely confused about that. They look at me like I'm an idiot or I have two heads or horns on my head. That's how confused they are about it. And you would think that in college and school, somewhere along the line, somebody noticed that they don't have sex and pee from the same hole. But the urethra is, an alien being in their world. They don't know what it is. Now, if you can't even correctly identify your urethra, how can you blame your partner, male or female, for not knowing what to do with your parts?
Right.
So if you don't understand anatomy, it's very hard to know how to pleasure it. So I'm not saying that somebody needs to understand anatomy like a medical school anatomy lesson. You don't need to know where all the nerves and arteries and veins go. But if you could label your parts on a diagram, like a 2-year-old or a 3-year-old would, I think that's a good start.
Yeah. Yeah.
And I think if you know the anatomy, then you know what to do with it, male and female.
It's interesting that you're saying this, because in my own practice, I will get women who don't really understand their own anatomy, haven't really explored what they enjoy, and yet somehow think their partner is supposed to know this. It's like,
yes,
they don't have to figure it out themselves. Their partner should just know, or should figure it out for them, as opposed to, I tell people, I think we're responsible for our own pleasure.
I agree. And, I'm all for women's lib and, not having to explain to men and, women having pleasure, but we are equal partners in this. It's a partnership. It's not a one-person game. I mean, that's called masturbation, but most women are too afraid to even masturbate. So that also starts the other problem of, if you don't know what works for you, how is somebody else going to know what works for you?
Right. And besides just, pleasure is sort of our birthright. What are are there benefits to orgasm? Like, is this, if somebody hasn't had one or isn't having many of them, like, what are the other reasons that it might be important to figure this out?
Well, I don't know if I could really talk about benefits per se. I think the benefits are a larger conversation. Like,
okay,
if you are having good orgasms, for that to happen, you need to have better vaginal health, for instance. You need to have better mental health. So I think it's really a conglomerate of issues, not just one or the other. And what are the benefits? Well, I think if you're having good benefits, you're going to have a better relationship with your partner. I think you're going to enjoy sex more, or sexual activity more. It doesn't really have to be, penetration. But I think communication in the bedroom means a better relationship overall.
Mm-hmm.
And I think, to me, that's probably the biggest benefit, not to mention that you have, an endorphin release, you feel good.
Right. Stress relief. And
I think all of those things. I think your blood pressure is probably going to be a lot lower if you're having good sex.
Right.
I think it's those things in my mind.
Yeah. So if the clitoris has, what'd you say, 8,000 nerve endings.
That's a lot, isn't it?
It is a lot. And that's pretty condensed also. And I continue to get people in my practice, male and female, that expect women to have an orgasm through penetrative sex, through intercourse. I don't know if it's a misunderstanding of anatomy, or if it's that's just what's portrayed in the media all over the place, but so many people don't realize that that's a minority of women.
That is a minority of women. And according to some studies, it's only 18%. That's 18%. And when I say this, people are horrified. I have a new Facebook group that I started. It's called Sex After 40. And in that, I did a poll. And I asked people, I put in different numbers. I said, 88, 18, 28, just 8 numbers in there. And do you know that the minority of them picked 18? I think most of them thought it was a lot higher.
Yeah. I mean, I talk to women all the time that think there's something's wrong with them, that this doesn't happen for them. That's what's supposed to happen. And of course, the partner might also think that, I'm not either doing a good enough job, or something's wrong with you. It's such a myth.
Yes. And porn, I think, is making it harder for women. And I'm telling you, it's not any easier for men, because you see these men with, massive penises, and, they have these crazy erections, and they seem to just keep going. So there's cut. But, to the men, it seems like one continuous thing. So, I mean, I don't think porn is making it easier for either one of the sexes.
Yeah. So what are some of the other options for women to orgasm? I mean, if it isn't going to happen in penetrative sex, how are you normally talking to patients about how to find an orgasm if they haven't had one, or how to increase their capacity for this?
Well, I try to make sure that their hormones are optimized, first and foremost, because if they have low estrogen and their vaginal area is dry, sex is not going to feel very good.
Mm-hmm.
An orgasm is a far cry. They're not even going to want penetration, period. It hurts. It's uncomfortable. And so I make sure that hormones are optimized. Beyond that, I try to do a few different things. I feel like it takes a village, and not just when it comes to raising children. It takes a village sometimes to even have orgasm for women, or better vaginal health. Because really, I think they're synonymous with each other. So I do a few things. One thing that I find works very well is an Osha. I don't know if you've heard of that, or any of your patients have done that, but I'm one of the few providers in the world certified in it. I was trained by the person who created the procedure to begin with. And I have done so many now. I have such great experience with it because it works. And to the point that we're now a center of excellence at Bawa Medical, because I have done so many and had such amazing reviews. And I honestly feel that if these women weren't truly having that benefit, finding that big change in their lives, they wouldn't waste their time writing these reviews. And it's not just about my practice that I'm saying this. I'm just saying this because these women are feeling that there's enough of a change that they're inspired to write a review about it. And normally, humankind is such that, we write reviews when we're mad, not necessarily when we're right. So that's the thing. So I think that what I do is I take a blood draw from the arm, spin it down in my centrifuge, turn it into platelet-rich plasma, and then we inject that back into the clitoris and the anterior vaginal wall. Now, when you hear inject and clitoris together, I know it makes you...
I was going to say, I'm squirming a little in my chair.
Like you clench up, right? But here's the thing. When your doctor knows what he or she is doing, there's a way to get this done completely painlessly. In my practice, it is a 100% painless procedure. And you read that if you see my reviews. So what I do is I have a numbing technique. So I numb the clitoris really well. And then I take that PRP and I put it directly into the clitoris. And then I put that directly into the anterior vaginal wall around where the urethra is. So what I'm doing by doing this is, let's talk about the clitoris first. When it comes to the clitoris, size matters. It's not just a penis where the size matters, the clitoris too, because, and I know I'm preaching to the choir because you do this for a living, but I'm just, speaking as if you didn't know for the sake of our audience. So the bigger the clitoris, the more surface area it has. Now, as with age, it's not just your face that sags and goes to hell. The clitoral tissue, what can I say? I'm sorry.
That's okay.
Simplified, right? It does go to hell.
Yeah.
What can I say? There was me before 40 and then there's me after 40. Clitoris itself will shrink over time. And what this PRP does is it helps you build a little more volume in there. And yes, some of that liquid will go away, but some of it will stay and will form more collagen. And so now you have a slightly bigger clitoris. I'm not saying it's big enough that you're now going to have a bulge in your pants.
Right.
It's just, a clitoris is so small that even a small increase is a big increase relative to the size. Also, what it does is it forms new blood vessels. It makes the nerve endings more sensitive. So for us, the clitoris, which is so important for sexual pleasure, is now charged. It's ready to go. And it's more sensitive. It's slightly bigger. It's just easier to have an orgasm with a clitoris that's optimized.
Yeah.
We're kind of biohacking the clitoris. The other thing is the distance between the clitoris and your vaginal opening. So the smaller the distance, the easier it is for the penis to have friction against your clitoris.
Right.
That we can't change, but we can, by making it slightly bigger, at least give you a fighting chance. And then what I also like to do is with the Osha for the internal vaginal part, it makes it more lubricated. It does make it more sensitive. So it's the same stuff that, happens to the clitoris happens inside. And if you have mild incontinence, it will help you with that too. Because remember, I'm putting it around the urethra as well.
Yeah.
Now, the other thing that I find works exceptionally well for men, and we did that for men for a long time in my practice, was acoustic wave therapy. And then we said, well, why aren't we using this for women? So we started doing acoustic wave therapy in women as well. And what we're doing is we are going in there and we're breaking up blockages, plaques that build up. And then we are bringing healthier, more oxygenated, good blood flow into the area.
Where are these plaques forming? In the blood vessels? Is that what
the blood vessels? Yes. Okay. If you think about it, I'll give you a good example. If you think about how the risk for heart attacks goes up when you're above 40, 50, the older you get, the more chances you are of having a cardiac event. While blockages are not the only reason why you would have that, they are a main reason why you have that. So in the heart, you have to put in cardiac stents and do a cardiac cath to get to those blockages because you can't jackhammer your heart. But essentially, we are jackhammering the clitoris or the vaginal area or the penile area. And the beauty of it is acoustic wave therapy is painless. It doesn't sound great. It's a little loud, click, 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 but kind of like an MRI. It's like that annoying sound, but it's not that bad. I promise. It's a bad example.
I haven't had an MRI, so
okay, that's fine.
I have no context on that.
For an MRI, you need earplugs or you don't need any of that for this. But it's a sound. But that said, that's the sound that is causing the blockages and the plaques to break up. So the same thing happens down below. Your chances of having erectile dysfunction as a man of about 10% for every decade of life. So 20% of men in their 20s, 30% of men in their 30s. Now, women don't have that kind of data behind their orgasms. We've been left behind a little bit.
Right.
But the idea remains the same. Our anatomy is essentially the same when it comes to the vascularity of it. So we also develop blockages. So when we can go break down those blockages with acoustic wave therapy, we can then have a better chance of stimulation, of sensitivity, of good blood vessels, healthier nerve endings. It just works better. And then by doing acoustic wave therapy, there haven't been enough studies, of course, but it appears from what we're seeing in our patients, we are strengthening the pelvic floor.
Give me a sense of what this looks like. I mean, what's the mechanism by which you're doing this acoustic wave therapy?
Think about an ultrasound probe. Now, we're not inserting it all the way into the vagina. It's more external, a little bit into the introitus, but we're not taking it all the way in like a pelvic ultrasound.
Okay.
But it looks like a probe. Think of a bottle of water, a skinny bottle of water.
Yeah.
Basically like that. And then we're putting it on your genitalia and we are using it. It also brings blood flow immediately to the area. So one of my patients, she's hilarious. She sent me a video. It was so sweet of her. She sent me a video later after her treatment. And she said that she took Bob out for a spin. And I had no idea who Bob was. Bob was a battery operated boyfriend. Who knew? Things you learn. I thought I knew and had seen just about everything there was to see. Apparently not. So she brought Bob into my world. So I now know who Bob is. So she took Bob out for a spin. She said her orgasm was more intense. And this was immediately after the treatment. So at this point, she's had one treatment and she's already noticing that much improvement. She also said that while she doesn't normally look at her vaginal area, which comes to my point of not looking at your own anatomy, she said from what she remembered her vaginal area to be looking like, it seemed more pink because it brought better circulation in.
Right.
It does work well.
How many treatments do you do usually with either of these things? And do you do both with most patients? Like you're doing both the pshot and the sound wave therapy?
I try to because they're very synergistic. I honestly feel that 1 + 1 = 5, not 2, because they truly amplify the benefits of each treatment. Because if you think of it this way, the pshot or the pshot, depending on whether I'm doing it in a man or a woman, it takes your growth factor and stimulates your stem cells. So there's a lot of rejuvenation happening. Now, if by doing the acoustic wave therapy, we are breaking up blockages and getting more circulation to the area, you now have a better chance of that pshot or pshot working. So I think that in my patients who have had them together, I have seen an exponentially better improvement than somebody who's just had the pshot or just had acoustic wave therapy. They work independently. They're just so much better together.
Yeah. And so is this a series of treatments that you usually do with people, or is it a one-stop, come in once and that's it? Or is that different for different people?
Well, I think that a series of at least 6 is a good idea for just about everyone. And after that, I say that if there's a problem that we're trying to fix, then do at least 6 more and then some maintenance. If you did it just for improvement, then still do a little bit of maintenance. Because here's the thing. If I had $1 for every time somebody said, I don't think I'm that bad yet, I could send my kids to Harvard. I mean, I hear that for everything, be it for hair restoration. I don't think I'm that bad yet.
Yeah.
They've got a bald patch at the crown already, but they're not that bad yet. And the face, they have jowls, but they're not that bad yet because they don't look as bad as their mother. So they're not that bad yet.
Right.
For the vagina, I have some incontinence, they'll say, but I'm not that bad
yet. Right.
What do you think that bad yet is? Do you want to be ready for depends before you come in and do something about it? Is dribbling every time you sneeze or cough not bad enough? Is that not bad quality of life? So I think that 6 is a bare minimum, but I say to my patients, at least do 1. And some patients just don't listen. And so I say to them, okay, if all you do is 1 treatment, at least do that 1 treatment, because then at least let's do that right before your pshot or your pshot. And invariably, they see the difference and then they'll come back and get more. So I really feel that 6 is a bare minimum.
Okay. Hey, we're taking a real quick break here in the middle of the podcast, and I want to share with you a free resource. If you are in a relationship where sexual desire has been an issue, where one of you wants more sex than the other, where one of you or both of you are struggling to feel desire for sex, this is the training for you. It's a free webinar that you can watch on demand. It's called How to Want Sex More, or Help Your Partner To, without feeling pressure or obligation. In it, I cover the 5 biggest mistakes that keep people stuck, blocked from their sexual desire, and it's going to give you ways to approach this differently to start to create a sex life that's really fun and easy for both people. you can sign up at intimacywithease.com/masterclass. What else can women be doing around vaginal health and sexual health besides these treatments, either in, as maintenance after they've done it, or just in general, other kind of advice you give people in terms of optimizing their functioning?
Well, I say that Kegels aren't all they're cracked up to be, honestly, because I know that some pelvic floor specialists may disagree with me. But my feeling is you can squeeze and improve your pelvic floor health only so much. Do they work a little bit? Yes, but I wouldn't base my treatment on just Kegels and pelvic floor therapy. There's more to it than that, just Kegels. So I think that that's really not going to solve anybody's problems. But I do feel that for more advanced cases, I find that vaginal laser therapy works beautifully. I do CO2 laser, and there's a little bit of downtime with that. We say no sex toys, no oral sex for a week, no hot tub for a week. Basically, you have a controlled burn to the area, but it's very comfortable. They have no pain after that. And in fact, even the treatment itself is not painful. You would think that a CO2 treatment vaginally would hurt. It does not hurt. And after that, they have no real discomfort. I have never once had to give anybody Percocet or Vicodin or anything. It's just a few restrictions. It works very, very well. And I had a patient who literally left me a review saying that she used to be soaked in urine after exercising, and now she's only soaked in sweat, which to me was such a huge, compliment. And I felt so good that I had changed her quality of life to that extent.
Yeah.
So there's that. The other thing I like to tell women is, the benefit of exercise. I think not enough people exercise to the point that it's actually helpful. A little bit of walking is good, but, a little bit of cardio is a good thing.
Right.
Some training is a good thing. It all helps towards, overall better health.
Yeah. It sounds like some of the things you're talking about, some of the changes you're talking about are age-related. So menopausal, postmenopausal changes that women might have. What else would maybe bring somebody in for this kind of treatment? What are the kinds of...
Childbirth's a big one. And a fallacy that people have is that if you don't have vaginal childbirth, that you're probably okay. Not true. You can have a lot of vaginal damage from even a C-section. You have a lot of pressure on your bladder. You have a lot of changes that happen because of a pregnancy. You don't have to pass a child through your vaginal canal to have damage. Clearly, that damages things, but you don't have to do that to have damage from childbirth. So there's that. There is clearly age-related problems such as, menopause and hormone imbalance. And you can have lichen sclerosis. And I'm sure you're familiar with lichen sclerosis. And lichen sclerosis is something that the Osha with, the PRP and with acoustic wave therapy, that can really help.
Really? Okay. That's good to know. Anything else you can think of that would sort of precipitate trips to Boca Raton to see you?
Well, honestly, I always tell people that they need to rethink wellness in general. I always tell people when it comes to facial rejuvenation, which I do a lot of, that you don't have to have a lot of wrinkles and sag before you do something about it. You need to think of it as prevention, not just restoration. Now, I am a cancer patient. I underwent chemotherapy and a mastectomy and the whole 9 yards for breast cancer very recently. But I have hair. I never went bald because I decided that I didn't care if people assumed that all cancer patients who do strong chemotherapy lose hair. I wasn't sure what that had to do with me. I refused to lose my hair. Now, I used to have long waist-length hair. Now I have short hair, but I have hair and no baldness. So I looked at it as a preventative thing. So I did laser therapy within my office for hair growth. I did some medications that I have in my office for hair growth. And I think at the end of the day, I did not go bald. And I think so much of vaginal health needs to be approached in that same way. Because if you decide, you know what, I want good vaginal health for a long time, I will do what it takes to not have these problems. I think it's a much healthier approach than developing these problems and then trying to fix the problem.
Yeah. Easier to...
I think that works a heck of a lot better.
Right.
So I have people coming in their 20s.
So tell me where people can find you. Where do they go? And, what do you have available for people? People listen from all over the country, maybe even all over the world. So they're not all in Florida, but
well, actually, many of my patients fly in from other states. I have a lady who comes in from Minnesota every 4 weeks currently for vaginal rejuvenation, just to give you an example. So they can find me on my website, which is bawamedical.com, BAWA medical.com. I'm also on Instagram under BAWA Medical, Bawa Medical. I am on Facebook under Bawa Medical Boca Raton. So they can find me there. Our website is a great resource for anybody who's interested because we have a lot of very, very good information there. I have taken great pains to make sure that I have read every word on my website.
Good. Yeah.
You would be surprised. That isn't always the case with some doctors.
Right.
So that information is correct. The things we talk about are legitimately things we can help you with. I don't like to overpromise and underdeliver. I would much rather underpromise and overdeliver. And I find that I never thought I would be changing lives by doing sexual health, yet here I am. One doesn't think of it quite that way when one starts in medicine. Nobody who enters medicine ever thinks, you know what, I'm going to be a sex doctor.
Right.
I took a very scenic route to being here. And even now, I don't just do sexual health. I do a heck of a lot of rejuvenation with facial rejuvenation, hair restoration. But I found my passion in sexual health because I found that this is an area that is being ignored by a lot of doctors. Mm-hmm. It takes a lot for a person to even admit that they have a problem. And once they admit to themselves that they have a problem, it takes them a long time, years on an average, to go get help.
Yeah.
Then when that doctor blows them off, some of them are so embarrassed and heartbroken, they don't go back again.
Right.
And the ones that do, then again, have a tough time finding a doctor who, A, admits that they need help, and B, knows what to do with them.
Right.
So I found that I was really filling a void in the space when I started doing this, be it even penile enlargement, for instance. I do penile enlargement, and I don't do it surgically. I do it with fillers and with PRP because I'm trying to grow their own collagen over time. And I find that it gives them confidence. It makes them feel better about themselves. It's not even, the assumption is that people are doing this because they want to look good in front of a woman. No, they feel better about themselves.
Yeah.
And I think if women took better care of their own health, they would feel better about themselves. And the ones that do it, who take that step, clearly are in a different place when they're done with their treatments in my office. So it really improves quality of life. So I'm very, very happy that while I fell into it, while this was not plan A, this is the path I've taken with my career now.
Yeah. Well,
really helping people, and it's lovely to be able to do so.
Yeah, and we're lucky to have you. I'm glad you can take the time to talk to me today, and thank you so much.
No, thank you so much. And, here I am, Dr. Kanwal Bawa, Dr. Sexberry. Who would have thunk it? Happy to help.
You've been listening to Better Sex. Please visit our website, bettersexpodcast.com, for show notes and additional episodes.
And that's a wrap for today. I really hope you enjoyed the episode. If you are enjoying the podcast, if some of this material resonates with you and you would like to make a difference and make sure that this keeps coming out in the world once a week, ongoing, there are a couple things you could do to show your appreciation. The first would be to go to iTunes and rate and review the show. That really helps us be found by new listeners when you review the show on iTunes. You can find a link at bettersexpodcast.com/iTunes. The other thing I want to invite you to consider is becoming a Patreon. For a small monthly pledge, you get some benefits. So for $2 a month, you get advance access to every single episode. For $5 a month, you get a chapter of my upcoming new book. And for $10 a month, I host quarterly get-to-know-you and question-and-answer chats over the web, and you get invited to that. I would love to have your membership in that, become part of the Better Sex family. You can find a link at bettersexpodcast.com/Patreon, which is Patreon. Again, thanks for listening. I'm glad you're here. Feel free to comment, ask questions, get in touch. I'd love to hear from listeners. Thanks.